I'd like to welcome everybody to the Medical Marijuana and Wellness webinar series. Tonight's topic will be dosing. This topic, as I mentioned earlier, was something that's very exciting to me. I know this is the key to really using medical cannabis effectively, and it's really the reason why medical cannabis is so successful. And it's something that I think is not really understood by a lot of folks as to how to do it, why to do it, and that type of thing. I do want to mention that I have the honor tonight of working with someone from MÜV, who is, I would say, very well schooled in the area of dosing. Michelle, please introduce yourself and tell us a little bit about yourself.
Hey there, everyone. How are you? So my name is Michelle San Miguel. I work for MÜV Dispensary. We have 60 dispensaries in the state of Florida. I have about 5 years experience in the state of Florida in the cannabis industry. Basically, my day-to-day consists of going to physicians' offices, educating patients, educating the doctors about products that we carry, just basically informing and just educating the community in general about the benefits, about the products, about the options that they have, because a lot of the times that I come into contact with these patients, they don't really know what's allowed and what they're able to use and whatnot. So it's a lot of educating on my daily basis. So dosing is definitely a big topic on my day-to-day.
Sure. Well, let's do this. I want to dive into the presentation. I know there's a number of topics that we will be covering. So let me dive into it here, and let's get started. First of all, I want to mention this is part of the Medical Marijuana and Wellness webinar series. You'll notice tonight we have our topic of dosing. Next week, we'll be doing pain management. Then we're talking about how cannabis can help athletes. In early November, we're talking about basically what your options are to consume it. They call it routes of administration, or the different types of methods to consume. We talked about helping with sleep. And then in November, we actually have a live seminar in the villages. We'll be doing 2 events, one in the morning at 9:30 and one at 1:30. And then that evening, I'll be hosting another webinar on terpenes. So we've got a busy next couple of weeks, and a lot of good topics to cover. I want to mention that tonight's webinar is being live streamed on Facebook, and also you will get a copy. If you're watching this webinar, you'll get an email after the webinar. It'll have a link to a YouTube video of the webinar itself, a copy of the presentation in flipbook format, as well as the resources that we use to be able to put this together. So I know a lot of people like to take copious notes, and you'll be able to get a lot of that information in the follow-up email, which should be out to you, let's just say by maybe tomorrow night, by Friday evening, it should be out there. In the meantime, I do want to mention, if you have any questions, if you take a look, like right down over here, you'll see a little Q&A button. It's like 2 little bubbles. You think here on the screen, you'll see it highlighted here. That is where we'd like you to ask questions. We know that there's a lot of questions that you might have about cannabis. We're here to answer your questions. Please feel free to answer questions. And by the way, there is no question that's a dumb question. Every question is good. One of the main reasons we do this is because we like to interact with folks and be able to really have them get the information they need to either feel comfortable or to make a decision if this is the direction that they want to go. So please feel free to ask questions and fill that in. There is a chat button, which is there. We tend to watch the Q&A a little bit more than chat, but it's something to just pay attention to. So Michelle, let's get started. So what are we trying to accomplish tonight? I think the question becomes, what are we going to cover? I know that in working with, and you've dealt with a number of patients, I get a lot of questions that people come up that say things like, it didn't work, so I quit using cannabis, or I felt high and I was uncomfortable, so I quit. It worked, but really not as much as I hoped for. I don't know that the product or dose, I don't know about what product or dosing I should take. I think I always get questions about what's my dosing, what product should I be using? Yep. Why can't I just smoke a joint and get relief? You kind of hear that all the time.
A good one, exactly. Yeah.
Yeah, you've heard that a little bit, right?
Mm-hmm.
It's too expensive again to find the right product for me. And then, of course, my doctor put the recommendation in the Florida Medical Marijuana Registry profile, but I didn't get a written prescription. Is that okay? So these are some of the questions that we're going to answer during this presentation today. And as we mentioned earlier, please feel free to ask any other questions that you might have, because that's what we're here for. But I know that we want to get out on the table all the information about dosing that's really important. Now, what's dosing all about? Well, cannabis is something that works with your body. It works with your metabolism, and it works with, we'll explain exactly how it works. But what's interesting is cannabis, much like alcohol and caffeine, it really is something that is individualized for yourself. I mean, I have friends of mine who will drink literally one drink and they're done for the night. I have other friends of mine who can drink a whole bottle and they're just getting started. And we've all run into those situations. And we've learned that it really is something. Caffeine is the same way. Some people can have one cup and they're high for the day, or they're excited for the day. Other people can drink a lot of coffee and it doesn't bother them. But really what we're trying to do with cannabis is understand, what is your tolerance to both CBD and THC? In other words, what makes you comfortable? More importantly, what are the best terpenes that work for you? Because the terpenes are the part of the cannabis that really turn on the healing effects that we have, and also what dosing forms are you comfortable with. Some people like the vape, some people don't like the vape, some people like tinctures. So the question becomes, how do we individualize this for you? And I wanted to point out over here, this is a document that was put together by Normal, by a gentleman named Paul Armangalo. And by the way, he has a 77-page document that goes with this and talks about how all the studies for the different parts of the body. This was done a while ago, but it still is effective. And cannabis can really help with a lot of different conditions, and really the dosing is the key to that. So, Michelle, what's interesting is all of our life we hear about the nervous system. Since I was a boy, I heard about the nervous system. We heard it was something that it was our sensory part of our body. It sends signals around. And what's interesting is if something happens where you have pain, or you hurt your finger, or you stub your toe or something, your body says, Houston, we have a problem. It tells your brain, and your brain says it has a problem. The question that's interesting is, what did your body do with that? And what I was fascinated with is why, when we found out about the endocannabinoid system in the late 80s and early 90s, why did it take so long for medical science to realize, if the brain recognized we had a problem, what it did with it? And this is what they found out. The brain handed over to the endocannabinoid system, which parallels your nervous system. It handed over that signal to be able to generate endocannabinoids, to be able to address various conditions that we find in the nervous system, your gastrointestinal system, your bones, your muscles. Fundamentally, what the endocannabinoid system does is it regulates pain, anxiety, memory, appetite, inflammation, and other immune responses. I just found it just was amazing that it took so long to be able to find that. But we know it's there, we know it works, and there's been a lot of research that really proves the efficacy of the endocannabinoid system. It's there. Now, why is this important? Because our body wants to stay in what we call balance. And when we talk about dosing, what we're really trying to do is to keep your body in balance. What does that mean? Well, I look at the nervous system as like the cell phone system for your body. It kind of communicates and says, here's what's there. And then I look at the endocannabinoid system as something that really looks like in essence, it's the firemen that come out and put out the fire and come over and help you with that particular situation that's there. But your homeostasis, which is the balance of your body, is what really, this is what really makes you feel good. Studies have shown that your body produces endocannabinoids to be able to address the various medical conditions that exist within your body. And what they found in the cannabis plant over here is that there are phytocannabinoids, that the structure of those phytocannabinoids match exactly the endocannabinoids in your body. That's what's really amazing, is that what it's able to do is they're able to put those phytocannabinoids into your body to be able to help your body to be able to heal itself. And that's the amazing part of cannabis that's really out there, and something that's really, really important. It's something that we see. We've heard about cannabinoids affecting our body in various ways. We've heard about THC and CBD addressing CB1 and CB2 receptors. What's really even more fascinating is that this goes with the whole dosing reason, we found that CBD also addresses a number of other conditions in your body, whether that's your coronary circulation, your blood pressure, helps you with your digestive system, helps you with your blood flow, helps with the temperature and pain. CBD is more than just addressing CB1 and CB2 receptors, or it generates, and it works with a lot of other receptors in your body. It really is an amazing plant to be able to help you in many, many ways. So, and I tend to look at it this way. So what we're talking about here is, why do we want to dose? Well, you've got endocannabinoids in your body. You're putting phytocannabinoids in your body. And the reason you do that is because as you get older, like you take myself, I'm a senior citizen, I'm not producing the endocannabinoids like I did before. So by being able to use phytocannabinoids and put those in my body, those phytocannabinoids get stored in my fatty acids in my body. And when the neurons, again, Houston, we have a problem. The nervous system says that we're there. What that does is it then goes and takes the endocannabinoids out of the fatty acids and turns them into long chain fatty acids. And then through your bloodstream distributes that to the part of your body that's going to help you. That's how cannabis works. Why is that important for dosing? Because that process is different for every person. As we mentioned, for some people, a little bit of THC, they can have it can affect them. Excuse me. Other people, it takes a lot of THC to do that. But it's something that's really, really interesting to see how this whole process works. You know, I think, Michelle, a lot of people perceive that cannabis, they thought it just went right into the CB1 and CB2 receptors. And what we found out is it really doesn't, right?
Exactly, it doesn't, and everyone's different. And that's what I tell all these patients that ask me, what should I take, what should I shouldn't take? And it's definitely, everyone's different in general. Everyone's different. It's not like taking an Advil or a Tylenol or, any of these other medications. So it's definitely, I always tell patients, the only person that's going to know if it's working is you. The doctor's not going to know, your husband, wife, no one's going to know. It's just going to be you and the medicine. You're going to figure out if it's going to work for you and what levels, it's going to work at.
Sure. So I tend to look at cannabis as really a medicine cabinet. That's what I find really interesting, because what it contains is over 450 medical properties are inside of cannabis. We have 120 cannabinoids, we have over 100 terpenes, and it's interesting that as you take the different cannabinoids that are inside the plant, and as they work together, what's interesting is 1 and 1 is 3. So if you take a CBD type of a cannabinoid and work with a THC type of cannabinoids, they work together to produce a better healing effect as far as the efficacy of just them working individually. And that's really the magic of cannabis, is really that 1 and 1 effect of having them synergistically work together to be able to help with different medical conditions. And there's a lot of studies going on right now to find out what cannabinoids and what terpenes work together to be able to help with various conditions. But that's what makes cannabis very interesting. It's not a cannabinoid. It is a combination of cannabinoids and terpenes to be able to help you. That's what makes it hard for Western medicine to be able to categorize this, because they want to study one plant, one cannabinoid, one pill, one technique to use it, and one condition. And unfortunately, it doesn't work that way. The way this works is more holistically together than just one thing. But we know it's very, very effective. Michelle, tell us a little bit about the entourage effect. I know that when you take a look at the plant itself, we have cannabinoids, terpenes, and flavonoids, but when they work together, they really work together and they enhance each other. Is that correct?
Correct. And this is what I always tell patients in Florida. As a patient, you're able to see these COAs. We as a medical marijuana dispensary have to show you the lab reports. So you're able to see the levels of terpenes on all these products that you're purchasing. So I always tell patients it's a little bit more than, just looking for the THC percentage. You have to look into, if there's any CBD in there, what other cannabinoids are in there, what terpenes are high, and what issues you're trying to figure out with any of these. What are you trying to cope with? What are you trying to deal with? And then just combine them together to, create that entourage effect. So definitely the entourage effect is definitely something everyone isn't really too familiar about. And this is why we're here, Sure.
But we know, for example, if you use CBD and THC has been known to have a psychoactive effect, but if we put some CBD with it, it lessens that.
Exactly.
So we'll talk about this as we're dosing, as you're trying to find your therapeutic level. You might get to where you cross it with THC and you get some negative effects. By being able to use some CBD, it'll literally bring you back down or bring you back to where you were before. And that works out very well. I know there's other techniques to do that, like doctors will recommend cracked pepper. I don't recommend eating cracked pepper, but if people like that, go for it. Yeah, but it's interesting how all these kind of things work together. And that's really the magic of cannabis. And we've been able to discover it. We've been able to study it. We know that it really exists. What we're really looking for is our sweet spot, is what we call it. That sweet spot is what I call what is the optimal dose, the therapeutic dose. We define that as being we have a low effective dose, so we're not taking that much of it, trying to look at what we're at, to get the positive results and minimize the negative effects. I know a lot of people have to work during the day. They have kids, they have jobs, and what you want to be able to do is you want to be able to take care of pain, take care of that anxiety, take care of that stress, but not necessarily run around and be high, and also be able to be in full function and stay focused on what you're doing. And that's really what we're trying to do, is we're trying to figure out, when you start with this, we have a concept called go low and go slow. As you're going through this, as you're trying the different dosing levels, you're being able to feel a little bit better, a little bit better. Once you find that level, you'll feel good. And then if you use a little bit more of it, you'll find it doesn't work as well. And so the idea is to be able to back down. Key is you are in control. You are absolutely in control. I know that in many cases, people will go to a pharma to a doctor. They'll recommend a pharma drug. What they'll do is they'll try it. You'll try it. It either doesn't work or it'll have some sort of a negative side effect. And the first thing you have to do is you got to call your doctor to get the prescription redone. The nice part about cannabis is you don't have to do that. You can just, you yourself, through this course or through this particular webinar and through using dosing, you can be able to adjust that, and you maintain control of the dosing levels and the relief that you're getting with cannabis. That's what I find amazing.
Yep, I agree. And this is what we tell patients at the dispensary also when they're coming in, and, as a day-to-day also, like I tell patients, you need to find that spot, that sweet spot, exactly what we're talking about, that you're going to be comfortable dealing with your conditions, your pain, whatever you're going through. And it's going to allow you to do, your regular daily activities. It's not going to prohibit you. It's not going to, lock you into the couch. You're not going to feel bad or anything like that. You're going to be able to do your daily activities like you used to before. And it's going to be an overall just relief in general.
Sure. So what we're talking about doing is something called go low and go slow. If you take a look at when you start with a low dose, and we'll define exactly what a low dose is, what you're trying to do is say, how much do I take to be able to get my therapeutic level? So you may try a little bit more, you may get little or no relief while you're going through this. Then all of a sudden you'll find out you're starting to get some relief without the side effects. And that's when you're getting to what they call your therapeutic dose that you begin to feel good. And this has to do with what they call the titration. And we'll define titration. We'll get all those terms laid out for you. But what's interesting is once you get past this particular level, you'll begin to feel uncomfortable. And we'll define what uncomfortable means in just a few moments. But really, when you find out that, it's amazing to me, for example, I have 7 herniated discs in my neck. And when I was using medical cannabis to relieve the pain, I knew when the pain was there, and basically I knew when the pain was going away, and I knew when the pain was being controlled. But I also knew if I took a little bit too much, it either caused some anxiety on my part or some areas where I lost some motor functions. I was able to move back, dose down, and find that therapeutic level to really help me that's over here. That's the magic of really dosing that's out there.
Yep, totally agree.
Yeah. Now, why is that? Why does that happen? Well, there's things that control, it's something that things that really are in our control. When you take a look at pharma drugs, they're all based on weight. Based on their weight is how they describe how they prescribe the pills that are out there. And again, same thing happens with pharma drugs. Sometimes you need to take more and sometimes you need to take less. And you basically have to work through your doctor to be able to find out a lot of that. Hopefully the first shot really works when it comes to pharma drugs. But what's interesting in this case, we have our metabolism, we have our medical condition, our anatomy, our cells, our experience with cannabis, and then also the physiology, the endocannabinoid system within your body that's there. How do you control it? How do we control cannabis, and how do we control the dosing? We call it routes of administration, and this is how we use it. Are we going to use edibles? Are we going to use vapes? Are we going to use flower? How do we actually consume it? It has to do with the dose, what concentrations that we use, high CBD, low CBD, THC, that type of thing. It has to do with which cannabinoids we use and which terpenes we use. And then also, there's individual product formulations that you may use. I personally make a formulation for myself after years, literally after 7 years of using cannabis. I know what works, and I know some formulations I can put together to really enhance or make it so that my pain is at a minimum. But on the other side of the coin, I maintain my focus, and I'm able to really lead a normal life. Let's put it that way. It's there. Now, this is an interesting one. It doesn't make any difference how big or how small you are. Everybody's metabolism is different. Do you want to chat about this a little bit? Because you've probably seen patients that have been very large that are really susceptible to THC, and some people that are smaller that they can tolerate a lot of THC, right, Michelle?
Yep, definitely. It's definitely I see it all the time, especially with the older. You would be surprised, but this is what I always talk to patients about. You know, they're getting all these prescription medications and they're already at a higher dose with that medication. So when they try cannabis, it's going to be completely different, you know, when they try it. But I do see a lot of patients, you know, very small little ladies taking, you know, higher doses, you know, but they're also more, I've seen a lot of them more open to trying different routes. You know, they'll try patches and creams, and they'll also try, you know, drops and capsules during the daytime, and maybe some smoking at nighttime. So it's just a combination of what you're able to do with, you know, your medicine and how you want to regulate it.
Yeah, and what's interesting, we call it biphasic. In other words, while you're titrating up, when you find that therapeutic level, it really works very well. If you go over that, you may have some negative side effects. So this is what we're trying to figure out is where is the lowest therapeutic dose you can take to basically get the best positive results and the minimum effects of the negative effects that are out there. Terminology. So there's different terms that you'll hear when you hear about dosing. One of the things is in the sweet spot, we talk about the effective dose. Again, we talked about the positive experience with the minimum negative experience. Terpenes, and Michelle, tell us a little bit about terpenes, because they're really the GPS of cannabis. This is what really triggers the medical benefits of cannabis itself. I know a lot of people think it's the strains, but in reality, it's terpenes that are in the strains that dictate the medical effect. Is that correct?
It is correct. And that's what I always tell the patients, you know, it's more than just the THC percentages, depending if you want, you know, something more sedative, or something more uplifting, you know, something more stimulating. You're going to look for specific terpenes within that COA report, or within that flower that you're going to buy, you know, within the products that you're going to purchase. You're going to look for specific terpenes that are going to help you get more sedated. You know, they're going to help you. It's just different. Let's see. Do you have a question?
No, I'm just saying, I was just telling people it's okay to ask questions.
Yeah. So when I tell patients, you know, if you smell lavender, automatically you're going to get that very calming sensation. You know, that same terpene is found in cannabis, you know, so it's associated in different smells with patients, so they could just, you know, just start to see the difference in what they're looking for within their cannabis. But terpenes are a huge part of this, you know, and it's all about educating them. But you find terpenes in everything, you know.
And we'll talk a little bit more about terpenes. And by way, I should point out, in the future, we have a terpenes webinar. We have a number of different things. And really, I believe the key to using medical cannabis effectively is making sure you get the right terpenes that are there. And that also is affected by the routes of administration. You can see, to get the right entourage effect, you need the terpenes and flavonoids. Certain routes of administration really cater to making sure that the flavonoids, the terpenes, and cannabinoids are all there. You probably heard of something called Rick Simpson oil, RSO, which is whole plant, which gives you all of those. There's other things that happen. I know that, and we'll cover this in routes of administration, but you've got to be careful about the heat that's being used with cannabis when you heat it up, because you can actually burn off a lot of the terpenes, flavonoids, and cannabinoids. And so what we're trying to do is make sure that the way you take it maximizes the medical benefits that you're really looking for that's out there. So, so let's say, so how do we find our sweet spot? What do we do to do that? I mean, we talk about going low, we talked about going slow. Really, our goal again is to find out what's our therapeutic dose, how much we tolerate THC, how much we tolerate CBD. The real key is, and I can't emphasize more about this, listen to your body. I get constant questions about, how do I know, how much do I take? How do I know it's working? Your body will tell you. Trust me, when I started using cannabis for pain, and I started managing my pain and having my pain level go from a level of 7 or 8 down to a 1, you listen to your body, you're there. Your doctor can't tell you how your body reacts, because again, like alcohol or like caffeine, everybody's body is different. You can kind of get a general idea, but to land that bird, to get that right down to where it really helps you, you've got to be able to experiment a little bit to find out what's good for you and what your body's looking for to really get the help that's there. Now, a couple of factors to consider, and I think, Michelle, this is something you can help me with. A lot of people will use like CBD oil, they'll say, well, I got it. I want to not, I want to take a test and not be tested positive. And good and bad news. Good news is, I think I talked to you about the cannabis being stored in your fatty acids. By the way, whether it's hemp-based CBD or it's marijuana-based CBD, it's going to be stored in your body, for your fat cells, for at least 30 days, maybe more, depending on your body. So using CBD by itself, even broad spectrum CBD, meaning there's no THC in it, you're still going to have that problem. And I know that the other thing that's interesting about cannabis is it loves food. It likes fatty foods. You know, you take it without food, it works. But if you can eat it, when you can take it with the fruits, with vegetables, with fats, with potatoes, things like that, vegetables, it works a lot better than by itself. That's a good combination. Is that correct?
It's correct. That's what we always tell patients, you know, for the first time, if they're trying any distillate or any Rso or anything like that, we always tell patients to try with some peanut butter, you know, or some cheese, something fatty, and then you'll be able to see the effects a little bit better and a little bit quicker also.
Right. And then also, again, in going low and going slow, as we're recommending that you try a little bit more cannabis, literally take more of it and maybe more times a day. If you get to a point where you're not feeling comfortable, keep a bottle of CBD tincture oil around, because if you take tincture oil with what you're doing, it'll actually counteract the psychotropic effects of THC, and let you get back down to that, what I call your normal, where you're beginning to feel comfortable again in something that's there.
Yep.
So now let's hold on here. Let me not. I'm gonna go back into here. So let's talk about the symptoms that you'll see. We talked about earlier. How do you know? Where do you know when you're down here that sub-therapeutic range? Where do you know where your toxic range is? So when you get over here to your toxic range, how do you get over here? How do you know that you're having that it's not really good for you? Whether you can get some severe or some mild reactions to it. Michelle, tell me about the severe reactions that people have.
I'll tell you personal experience. I ate a edible. It was a quad dose. It wasn't in Florida, and it just made, you know, it just makes your stomach upset. But you end up falling asleep for about, 6 hours, but you do get the best sleep of, your life, but it is very upsetting, just stomach upsetting, nausea, cotton mouth, that dryness in your mouth is also, one of the symptoms, or, the feelings that you get after, consuming too much or whatnot. A little bit of anxiety, and rapid heartbeat at times, but like you said, you always should carry some sort of CBD, not in some sort of vape form and drop form, in case you are, trying it and you do feel a little bit, not that great.
Sure. I mean, some of the severe things you have, maybe you get paranoid, you have difficulty standing, you're getting over here when you may feel overwhelmed from a sense of doom. You have difficulty staying awake. You mentioned falling asleep for 6 hours. You have some mild things you might feel is a little bit of a rapid heartbeat, dry mouth. You mentioned that earlier. Red eyes, dizziness, anxiety. What is couch lock? Couch lock is where you just feel so relaxed, you just want to sit on the couch and just chill out. And that's what I find very interesting. Cannabis is not like alcohol. Alcohol is more of a stimulant where you kind of gets you up and gets you moving. And I know they talk about sativas doing a lot of that, but really cannabis really relaxes you, and it really causes people to really kind of chill out and really, how should I say, get into a mode where you're more relaxed than you normally would be. Let's put it that way.
Yeah,
so
probably might order a little bit too much food, or go into the refrigerator a little bit too often, if anything, but that might be another symptom in the severe case.
Sure, but this is where you're trying to find that point right in here. And as you're starting to get over here, if you see some of these symptoms over here, you're probably getting over it. You're getting a little bit too much. So what do we do to counteract that? Well, let's talk about something called ratios for a second, okay? Because you'll hear about things like 1-to-1. What does that mean? 1-to-1 means you have 1 CBD to 1 THC in the product itself. So if you hear about the fact that it has 500 milligrams, that'll mean is it has 250 milligrams of CBD and 250 milligrams of THC. That is what a 1-to-1 is. And your typical bottle will have, it'll have 30 milliliters. okay? And it'll typically have a number of milligrams. Now, be careful because milliliters is liquid, milligrams is the amount of product that's in that liquid. How concentrated it is the best way of putting it. Typically, what I typically talk to people about doing is start with, I think tincture drops is the best way to start with cannabis. And if you have been using cannabis for a while, to find your therapeutic range, I still recommend using tincture drops. You can take that eyedropper, and if you take a look at the bottom part down here, 0.12, that's probably not a bad place to start. And again, try that for a day or two, once or twice a day. If you don't get any reaction to that, move it up to 0.25 for a day or two. If that doesn't work, then move it up to 0.5. Again, if you begin to feel a little bit something, but you're not completely satisfied, you go up to 0.25, and you can continue that up to 1. You can continue it up to the different levels that are there. So this is what we mean by go low and go slow. Try it for a day or two, see how it works. Then try it for another day or two, see how it works. I know my wife, for example, went through a period where she said this just isn't working. And then once we found a therapeutic range, it was like a whole new life. She found that it helped her quite a bit. She was able to get out and move. She was able to do certain things that she wasn't able to do before. So you'll know when you get there, but really titrate up slowly, because if you titrate up too fast, you'll bump right into all those negative effects, and we don't really want that. What we want you to do is have a positive experience. So what is this? This is a very busy slide, so I'm not going to run through all of this, but what we're basically talking about doing is what I just said. Try a little bit for a day or two, then move up a little bit, trade up a little bit more. And what happen is you'll know where it feels good. And when you use the one-to-one products, you'll know when you feel good, you know when you don't feel good, you know how much it is. 0.5, 0.75, 1 milliliter. You'll know exactly at what level to take that. And by the way, take it either once a day or take it in the morning and in the evenings. A lot of people, like I have my particular case, because I have herniated discs in my neck that don't go away, I literally have to titrate. I really have to use it 3 times a day, sometimes even 4 times a day, to be able to control the pain and be able to maintain my ability to work and stay focused. But really what we're talking about here is how do you titrate up, going up and doing that. Once you find that level, once you find where that relief area is, then you back down to where you felt good without the negative effects. You might want at that point in time, try to increase the amount of CBD in the product. Instead of being 1-to-1, you might try 2 CBD, 2-to-1. You might try 4-to-1. You might try 8-to-1. I know in my wife's case, she uses 12-to-1. She found that to be the most effective. Well, because CBD, as I showed you in that slide earlier, has a lot of positive effects on your body, and being able to increase that really will be able to help you be able to adjust yourself for a lot of different conditions. CBD is great for relieving inflammation. If your pain is related to inflammation, taking more CBD, THC may not be the answer. It may be taking some CBD, getting that inflammation to come down and reducing the pain from that inflammation. You've probably seen that, haven't you, Michelle?
I have, and that's what I usually tell patients, usually starting with a 1-to-1. If you can't find any relief there, then just go for a little bit more THC. But if you're finding that your pain is coming from any of the inflammation, maybe on your legs, your knees, anything like that, you do need a little bit more of CBD, and it needs to be a constant thing. It's not something that you take on a Monday and then on a Friday you remember, and then 2 weeks later, you take again. It needs to be on a constant regimen so your body actually knows what's going on and starts, interacting with the endocannabinoid, starts, latching on everything. So it's you need some CBD in general with everything.
Yeah, by the way, I'm going to remind everybody, if you have some questions, please feel free to ask. Don't be shy. That's what we're here for. We're really here to answer your questions. Now, what's interesting is in certain cases, people take cannabis maybe once or twice a day. It helps them, especially with anxiety and stress, in the mornings, maybe midday or in the evenings. It'll help them quite a bit. In certain cases, and I'll take my case where I have pain, I'm trying to manage pain on a 24-hour basis. I have to come up with what I call a regime, a program to really cover all the times of the day. And we'll show you in the different routes of administration. We'll show you that the hours of which it's effective. So being able to consider that, being able to cover that is really, really important. And also there's something called microdosing. I'm going to introduce that term right now. We're going to define it and talk about it in a little bit, but that's also another way of taking just a little bit of cannabis throughout the whole day can really help you. It's very much like a lot of people will tell you, a lot of physical trainers will tell you, rather than eating 3 meals a day, maybe 5 or 6 meals a day, but a little bit as you go throughout the day is a lot better for you than just one constant meal. Very same thing happens here with cannabis. So let's talk about the routes of administration, because how do I take it? So now that I'm gonna try it my therapeutic level, how do I take cannabis? What makes it really effective? Let's start with one that is probably one of the most popular, and that is inhalation. The inhalation includes smoking a joint, inhalers, vape pens, and concentrates. Do you want to talk a little bit about this, Michelle, about how long it takes for it to work and how long it works?
Yeah, usually I tell patients, the fastest way of, absorbing your medicine or, using your products or anything like that would be the inhalation, just because it is the fastest. I always tell patients, if you feel like you're getting a panic attack, or, you have, you wake up with pain, or you can't fall asleep, or you need something really quick, inhalation is going to be definitely the best way. And it does last about 2 to 6 hours. I'll say 2 to 4, more or less, but inhalation is definitely the way to go. And you could use it in all different forms. You could do different types of cartridges. You could, smoke flower. You could do the disposables, just different types.
Sure. Well, what's interesting with inhalation is a lot of people will say, well, I'll just smoke a joint and I'll get all the relief that I want. Well, what's fascinating is that when you roll that joint, you take that little paper and you roll that joint and you put it together. By the way, there is, and in talking to a number of my friends, especially the veterans, they love rolling the joint. There's a therapeutic effect of rolling a joint, and I understand that, and I think it's cool, and they should continue to do it. But what's fascinating is when you take that joint and you put that flame to light it, that 500-degree plus flame, it burns off half of the cannabinoids, all of the terpenes, and all of the flavonoids. So basically, by lighting up a joint, you're basically diminishing the medical benefit of that joint literally by almost 60%. And what's fascinating, though, is even though you reduce the medical benefits by over 60%, look at how effective it is. People do smoke cannabis. They are getting relief. It does work. Imagine if they got the 100% versus the 60%. All I'm saying is, it, as a medicine, is a very, very effective medicine. And what you may want to do is try to get those terpenes and the flavonoids that are in there. And that's fundamentally what concentrates are. Concentrates are being able to produce the product that still has the terpenes and the flavonoids in there. And by being able to control the temperature that you use, you're able to trigger which are the right products that you want to use for that's there. A lot of vape pens have a temperature setting. They'll have a button of low, medium, and high, or they'll have an actual temperature setting itself. My recommendation is between 365 and 380 for a vape pen. That's a real effective range, because you're getting the maximum amount of terpenes, maximum amount of flavonoids, and the maximum amount of cannabinoids without burning off the stuff that you really want. So inhalation, by the way, it works immediately. The thing that makes it really effective is, for example, in the morning when I wake up and I have a pain level, let's say a 7 or an 8, I'm able to grab a vape pen, take 1 or 2 hits from that, and my pain level will go from a 7 and 8 literally down to a 1 within 2 minutes. And the first time that happens, you just kind of look at yourself and go, wow, what's going on? But even today, 7 years later doing this, I am absolutely amazed that this happens, but it's something that really helps me control my pain. Now, I know that if I do that, it's only going to last a couple hours. So that's where I also use a tincture drop, sublingual, and put that under my tongue right after I take my hit from the vape pen. And what's interesting is for my case, it takes about 20 minutes to work. It takes about 15 to 30 minutes to work, but it covers most of the morning. It'll cover 4 to 6 hours of relief, which is what I want. So when the relief that I was getting from the vape pen wears off, I'm able to have the sublingual kick in, and that'll take me into the early afternoon to be able to keep the inflammation down and to keep the pain down. So what's your thoughts on that?
Sounds like you got a pretty good regimen there.
Yeah.
Yeah.
But yeah. I'm just really, and what you're doing with sublinguals is you're putting that underneath your tongue over here. And what it does is that causes the cannabis to be absorbed into your bloodstream through the blood vessels that are inside your mouth that are there. So it's kind of interesting. A lot of people say put it under your tongue and let 30 seconds later it'll go away. You could actually swish it around your mouth and have it work just as effectively. A lot of doctors prefer that as a method, but it's something that really is there. but I find that sublingual works very, very well. But it takes 20, potentially 30 minutes to work, and you need some patience between the time you take it, the time it actually starts working. Hence why I use the inhalation in the morning, because I want to be able to get rid of that. Now, one of the favorite things is topicals. And I want to compliment MÜV. You have a great line of topicals. And what's key about topicals is you put it on the affected areas. And what it does is it'll be able to have cannabis go into that part of your body to be able to help you. Now, the key to this is something called transdermal. Transdermal means that the product has been made and been brought down to an area, and you'll talk a little bit more about this when we talk about MÜV, but it's able to make it, it's the smaller the particles, the more it penetrates the skin, and more importantly, a transdermal product will get directly into your bloodstream, which is really what you want. You want to talk a little bit about your topicals and especially your patch, because I'm a big fan of your patch.
I'm a big fan of our patch as well. I put my patch on my shoulders. I have 2 shoulder surgeries, so I put it usually on my left because it bothers me a little bit more, and it treats the numbness that I have and the pain. So we have the transdermal patch, and then we also have the Evolve transdermal gel, and those both are transdermal. So you definitely are going to feel the effects a little bit sooner. That transdermal patch, 72 hours, and it's waterproof. So you just put it on, and it's going to help you throughout the whole 72-hour span, just releasing little bits of medicine so you're able to cope with it. But I think both of those are great, and combining also, your patches with your drops, depending on how you're waking up with what symptoms and how your pain is and what, you're able to tolerate that day. Patches are great. And so is that cream, putting it on your knees and your feet and your elbows and everything,
Yeah, I know that, like, where I do a couple times a week, I do a martial art, and at my age, my knees are always a issue. And I found that using the transdermal, especially the gels and the transdermal patches really help quite a bit to be able to relieve that pain. You have a great line of product. You have a sports gel and a pain relief gel. Put those on, and literally they work immediately. You can feel them within a minute or two. You'll be able to feel that they help you quite a bit. Now, the topicals typically only last a couple of hours. So why does it say 72 hours? Because when you have the patch on, what it's doing is it's microdosing. It's just releasing a little bit of cannabis during the day for the 72 hours, which is great because you can put it on and not have to worry about doing a lot of other things like your dosing and things like that. I use a CBD patch, and then I augment that with some THC products and some products that are high in terpenes and that type of thing to be able to really provide the right products to or right formula for my body to be able to address its pain that's out there. Oh, let's talk about oral products. These are always fun. This is where when you take an oral product, that's whether you take a gummy, whether you take chocolates, whether you try the different edibles, the capsules, that goes into your stomach. It's then broken down by your stomach, and it's broken down. And by the way, the Delta 9 turns into hydroxy Delta 11, which is a very effective, probably one of the better medical cannabis products that are generated. But that can take anywhere from 30 minutes to 2 hours to work. Very key. You got to give edibles time. There's a real saying in our business that about the time you think the edible's not working is about the time it kicks in and it starts working. So that's where you got to be really careful with edibles. There's many stories. I know I put my mother, who was diagnosed with cancer. I put her on an edible. I put her on a concentration of both sublinguals and edibles. Mom has the patience of a gnat, so obviously she took too much, and we've got her now at being able to take that little bit of chocolate bar, not eat half the bar that's out there. But it's interesting that it just take a while, but give them time, because edibles are extremely effective. And I'll take Mom, who's learned from to not eat half a chocolate bar. She now carries them around in her purse, and she knows exactly how to do them. She's been doing this for like 3 years, actually 4 years now, where she was diagnosed with cancer and told she's going to be gone, and she's still with us today. Just celebrated her 94th birthday, by the way. So,
oh, that's awesome.
Yeah, so I'm trying to point out, edibles are extremely effective, but you got to give them time to work. Just be patient. Just be cool. Just be patient with them, and it's there. And there are plenty of stories about people who were not patient.
Yeah.
And that always is a lot of fun to go over. It's there. So let me go up here. This is a chart. I'm not going to go through this. We've talked a lot about this, this is a chart we're going to include in our deck. It talks about, the time it takes to work, how effective it is, some notes on that. The one thing I do want to mention is, MÜV, you have Michelle, you have a metered dose inhaler. You want to talk about that? Because that's a very effective, you're one of the, in fact, I think you're the only dispenser I know that has that. And to be candid with you, it's a very, very effective product.
It is. It's a low dose also, so it's not a big macro dose or anything like that. It's a low dose, and it's actually very, very effective, and it's very quick to feel the effects. I tried it myself, and within a few seconds, I would say about 20 seconds, you definitely start feeling relief. And it's not, it's not harsh or anything like that. So it's definitely something you would like to try if you're not trying to smoke, or if you're not trying to use any of the vape pens or flower or anything like that.
Yeah. Now, I know a lot of people will say, my lungs are sensitive. I have a problem. I don't necessarily want to smoke. I know that inhalers have been used for many, many years to help people that have lung problems, because what they're doing is it's providing medication to the nerve endings inside of your lungs to be able to help them out. And this metered dose inhaler is exactly the same way. I've heard a lot of very positive things about that, both from people who are adults who find it easy to use, especially when they're just trying to use it around the house, or also with kids. It works out very well for children as well, just like asthma inhalers that are there. So there's a little guide for everybody that we follow up, you can take a look at. I mentioned earlier about temperature. What's interesting is when you get into that whole vape area, that whole area of being able to use flower, this is very effective, and it works right away. The nice part about inhalation is it does work right away, and it really provides that relief that's there. And candidly, some of it tastes pretty good. Now, on the other side of the coin, this is where the different temperature ranges. Cannabinoids are produced based on aging and also temperature. So based on the temperature, here are the cannabinoids that get produced from the plant itself. When you get that plant by itself, it's raw. It only has CBG, THCA, and CBGA in it. It doesn't necessarily have CBD, or THC in it. By heating it, that's what causes it to happen. And here's the different temperature ranges that are over here. And you can see the different terpenes, as well as the cannabinoids that are produced. Now notice that when you get higher heat, you get less terpenes that are produced. That's really the key that's out here, is you're burning off a lot of the cannabinoids, and you're really getting rid of a lot of the terpenes and flavonoids that are over here. I recommend at 365 to 380 degrees. One person always asks, if I buy a MÜV all-in-one vape pen, what is the temperature? It's 398, by the way. And I found out that if you buy one of your dart pens that are over here, it's actually 380 degrees, which is really where you really want to be. So it's something that, pardon?
That 300 mark is definitely like that, very nice. You're not burning off too many terpenes. You're getting everything about the plant,
Right. And if you look at products, I know you sell a Puffco product. The Puffco products give you the capability to actually set the temperature range. So you have a low, medium, and high. You'll have a blue, green, or red, or you'll actually have a temperature setting itself in that particular product. So the low range, when you see that blue, which is usually the lower range, it's in here. It's in this range in here. When you look at the green, it's usually in this medium heat here. You look at the high heat, this is what you're looking at, is this range over here. That's what typically you see with these pens. If you buy a pen that does not have a setting, this is probably the setting that you have right here. So let's take a couple of questions. I'm going to start with Anthony's question. Anthony, thank you very much for asking. He says, I have a question. How do we feel about Sativex, Marc? Well, I am not in favor of synthetics. And Sativex is a synthetic. Now, I think they've done a pretty good job with Sativex to try to emulate or try to mimic the cannabis plant. Personally, you can't produce an apple in the lab, you can't produce an orange in the lab, you can't produce a pear in the lab, and you can't produce cannabis in the lab. Now, they know the medical components of it, but what they're doing is they're trying to target different medical components without really getting what I call the whole plant experience. So I'm in favor of Sativex from two perspectives. Number one, I love the fact they've gone out and done a lot of research, both in UK and here in the United States, and shown the effectiveness of a cannabis-based product that's out there. I am not a favor of, by the other, so I like the research that they've been done. And I like the fact that they've got they made a lot of people aware of cannabis as an effective relief to help you. What I don't like about Sativex being a synthetic drug, or it is a drug, okay, it's not a plant. And more importantly is they don't give you the whole plant experience. What they're doing is they're picking and choosing what they put in there. And again, I wish they would go with a natural product. I wish we would test a natural product. But Sativex is really a function of, unfortunately, our policies and our government policies that we need to change to really make sure cannabis gets out there. So I'm in favor of it. I'm not a huge fan of it. I like what they've done, but I think they're better products. Let me put it that way. And a lot of better products are really naturally. You have any thoughts on that, Michelle?
Same with what I agree with you. You know, it's something made in the lab. It's not really something that you're able to grow. You know, there's no soil in it. That's basically my opinion on that. You know, it's yeah.
Okay, well, let's take the next question then. Hopefully, Anthony, I answered your question. If you need more, let me know. Send me an email. I'll be more than happy to talk to you. Jerry, you have a great question. It says, how long should you hold it if you smoke? How long should you hold it? 5 seconds, 3 seconds? There are more articles out there and opinions on this than there probably are authors. Some people will tell you that if you hold it a long time, it doesn't work. Some people will tell you that if you do hold it a long time, it works better. I think it has to do, I'll talk about my personal experience. I found that if you're looking at smoking cannabis, if you hold it for 2 seconds, you'll get one feeling. You hold it for 3 seconds, you get another feeling. Your body will tell you which is best for you. Some people can hold it for 5 seconds. That's where they get their maximum relief. Some people do 2 seconds. Some people do 3 seconds. Some people do 10 seconds, believe it or not. This is one of those things that I can't tell you what's best. Your body will tell you. Try 3, try 5, try 10. See what happens. I have found myself that if I can hold it for anywhere between 3 to 4 seconds, that's when I get the maximum benefit from smoking. That's what I found. I have a friend of mine who is a good friend of mine who he tends to find he gets his maximum benefit when he holds it between 5 to 7 seconds. And I know one other person that I work with, they really only hold it for a second or two, and that's when they get their therapeutic relief. So this goes back into that whole dosing formula. What works for you? Michelle, what's your thoughts on this?
I think it's also up to the patient, but you know, I feel that it's funny because I've taught, you know, very young people to very older, you know, patients how to smoke because they've never done it before. And I always tell patients, you know, inhale it and you're going to start feeling it. You know, you don't have to hold it in, you know, 20 seconds until there's no, you know, smoke or anything like that, but you'll start feeling the effects. You know, I hold it in about 2-3 seconds. I inhale it, I feel it, let it go, breathe it out. You know, I know if I hold it a little bit too longer, it's going to, you know, it's going to cause some sort of discomfort in my chest, or, you know, I'm going to cough excessively. And, you know, if I'm not trying to, there's no, you know, it's just depending, but I usually do about 2 to 3 seconds, depends, you know.
Sure, and that's your range, and that's what makes you feel good.
Yeah.
And that's what's there. And again, it's really individualized. And I will go back to the subject of our conversation. Try it. You know, try the 2, try the 3, try the 5, and your body will tell you what works and what doesn't work. There is no formula. That's what I'm trying to tell you. There isn't a right 3 second, 5 second, 10 seconds. That's why I love these articles that say, here's what you should do. What you should do is listen to your body. Your body will tell you what works for you. And I would say, try it. You'll know right away what works and what doesn't work, and it's out there. So let me move on. Colleen, you had a good question. Please explain Delta 9. Well, I'm not sure I'm going to really do a good job of explaining it today. I have a whole webinar series and a whole page. I'm going to send you, what we'll do for this webinar, I'll send you a couple of pages from our cannabinoids presentation on Delta 9. Fundamentally, Delta 9 is referred to as THC. That's the street name for it, or I should say the popular industry name for it. And what's interesting is that Delta 9 has a lot of medical benefits. It really addresses the CB1 receptors in our body, which are primarily in our brain, in our central nervous system, and it really helps to be able to help with a lot of different conditions. Primarily, it helps with pain. It also helps with mood, and it helps with attitude, because it's a very cerebral type of its product works on the sensors They're primarily in our brain with the cerebral part of it, and also in our central nervous system that we have. Now, what's the negative with cannabis delta 9? Delta 9 is very strong. Delta 9 has is very potent. So if you take a lot of it, it'll get you. Remember we talked about the therapeutic effect. It'll move you across that threshold to where you can get anxious, you can get paranoid, you could have trouble walking, that type of thing. It is one of the cannabinoids that are it's probably been the most researched cannabinoid that's out there next to CBD. And what's interesting is it does have a lot of medical benefits to you. But Delta 9 by itself will help with only various conditions. Really only use a product that has Delta 9 if you have some CBD in it. Because that CBD, again, that 1-to-1, 1 is 3, really help you with quite a bit of it. Again, I'm not going to really, I can go a whole half hour on Delta 9. I'm going to send you some information on that. I hope that answers it. I hope it gave you a quick overview. Michelle, you have any quick overview questions you want to bring up?
No, not really. I'm good.
Okay. Now, one of the, Thomas brought up a good question, and that is, you made a comment about taking something if you feel anxious. What is the name? How does it work? And how much do I take? I cannot tell you how many people I work with that have anxiety and stress. Okay. Anxiety is just a feeling of doom. It's nervousness. It's brought on by a whole bunch of conditions. Anxiety is fascinating in that it's really something that's important for our body because it gives us that fight or flight sensation. You know, anxiety can actually work against you where you just feel overwhelmed and you just get locked in. Anxiety can also be a huge motivator. And I say that because I played professional sports for a number of years, and getting excited or getting anxious before the game, I use it as a motivator. I use it as being able to, again, that caused me to really concentrate, pay attention to what I'm doing, get rid of the outside distractions and stay focused. So it really has a plus and a minus to it, but a lot of it is the minuses that people feel that really get them that they're. Stress is a reaction to anxiety. It's your body's reaction to whether it's physical or mental. That's the reaction that's out there. Now, what products to take? Typically, high CBD based products work very well. I know that in certain cases, I know one patient I work with took a product that has literally 20 CBD to 1 THC, and it helps her with her anxiety, and it works very effectively, very well. I know other people that try a 12 to 1, but I would say which product to use. First of all, stay in the category of looking at something that really is high on CBD, low on THC, and also from a terpene standpoint, look for products like myrcene, which is very good. Look for products like linalool, which is lavender. Look for products like limonene, and they'll help you quite a bit with anxiety. I would stay away from, when you're looking at anxiety, I would stay away from products that are high in THC. Even a 1-to-1 product could be a little bit too much. What I'm saying, if you have anxiety, that's there. Your thoughts, Michelle?
Same thing. You know, we sell drops, CBD drops. You know, you could always find CBD inhalation. We also have a CBD RSO, which is a 20 to 1. So that's something that, you know, you could always use. And that's just basically going to be able to just take the edge off. You know, if you're feeling the anxiety in the morning, you know, these drops or capsules or the RSO last 4 to 6 hours in your system. So it's going to be able to help you with that relief of the anxiety for most of the daytime, you know. So, or if you're feeling it at nighttime, you know, you could take it for that period of time, and, you know, it's going to definitely take off the edge, and it's going to help you out throughout the day.
Yeah, I think that RSO you were mentioning, the 20 to 1, that's a very, very effective product for anxiety. Now, people are going to say, what's an RSO? Okay, RSO stands for Rick Simpson oil. Rick Simpson, many years ago, I should say many years ago, 20 years ago or 25 years ago, had melanoma, and he took cannabis, and he tried all kinds of things, and there wasn't really a lot of things working. He kind of in his kitchen made a formula using whole plant, and he used the whole plant, didn't extract anything, they just put it all together. They made this thing called RSO oil. Now, the RSO oil that he made initially was very thick. It was almost like tar, but he found it when he put it on, it really helped get rid of his melanoma, and it helped with a lot of other things. What they have found out since is it's very, very effective for things like cancer. Okay, in fact, it's probably the primary treatment for cancer that's out there. The good news is it works. You got to be very careful though, because a lot of RSOs that are made are high in THC. And that's what I love about the MÜV products. You've been able to make a very effective product high in CBD, which can help a lot of people with anxiety. It's out there. So when you ask for the product I'd recommend would be the MÜV RSO product that's really high in CBD.
Yep. It's the
Is there a
ACDC.
particular product name for it? Is it orange or you have an orange?
It's called ACDC.
ACDC. There you go. Okay. That's really, really good. So I hope that helps quite a bit. Reese asked a question: if you want to experiment with ratios other than 1-to-1, do you need to mix it yourself? Well, there's two schools of thought on this. First of all, when you go to a lot of dispensaries, they'll tell you, I have a product that's a 4-to-1, a 5-to-1, a 12-to-1, a 10-to-1, that's all out there. And what happens when you follow that particular line of thinking, you end up buying a lot of products to be able to try them. That's expensive. What do I like about MÜV? One of the things I like about MÜV is MÜV makes a CBD product, they make a 1-to-1 product, and you make a THC product. And you're able to kind of like your own little bartender, put in 1 or 2 drops of CBD or 1 or 2 drops of THC. You can put in 4 drops of CBD and 1 drop of THC, AKA, you get your 4-to-1 ratios that are out there. And so MÜV actually makes it very easy for you to be able to buy, candidly, 2 or 3 products of CBD, THC, and maybe even a 1-to-1, and just mix your own, be able to get the ratios that are out there. And that's what I think one of the real benefits of MÜV. You want to mention a little bit about that?
Yeah, like I agree with you. We also have the gummies are 2-to-1. So if you're trying to go for that alternative, having some sort of edibles, but not full THC, and you are a little bit too sensitive for the 1-to-1, you could always try a 2-to-1, and we have different ratios, different capsules, capsules and drops with the different ratios, so you're able to just measure yourself out. But I have patients that take a certain amount of CBD in the morning to cope with their anxiety, and then take a few little bits of THC, and that's their ratio. That's their little cocktail that they're doing, and it's working for them. So I feel like everyone just needs to find that sweet spot. So you could always combine your ratios. You could combine your products and create your own ratios at the end.
Sure. But I like the fact that you're able to do that. I know that I've used MÜV products for years for that particular reason, because it makes it easy to be able to get my dosing down. And when I have new patients, it really helps them to be able to. And I know Denise might say, well, you got to mix your own. Listen, it gives you the control. It's not very difficult to take an eyedropper and just drop it into. Now, what I also like about the MÜV products are they're very water soluble. So some people put them in coffee, some people put them in drinks. Obviously, you can put them in edibles. But I think being able to use them in some sort of a liquid form, either straight or mixed with something, is really, really effective. So thank you, MÜV. Thank you for doing that. So Colleen has a great comment, not necessarily a question, I guess. It says, I've learned the hard way that high THC made my PTS symptoms worse. The answer is yes, it does. And that's good, again, where you pass that therapeutic level, heading over to the other side, it will actually do that. And also, Colleen, what you really want to pay attention to is something called pinene. Pinene is a great terpene that helps a lot with pain. However, pinene will bring back memories. So if you have patients that are worried, like Alzheimer's and that type of thing, pinene's great. For PTS patients, I tell them to stay away from pinene, because it can bring back some memories that they're really not looking for, and it does cause it to do that. More THC is not necessarily better for you. Okay. In many cases, once you find that therapeutic level, less THC helps you quite a bit. I found that when I had my, being a senior citizen, I had a left knee replacement. And if you ever want to see pain, go have a left knee replacement. And I found that more THC didn't necessarily get rid of my pain. I found that more CBD, I was actually using a ratio of about 4 CBD to 1 THC, because what it did was, my problem with my knee replacement was inflammation. It's the swelling. Swelling was causing the problem. Yeah, I had a problem with obviously my knee healing, but it was really the inflammation that was causing a lot of the problem. And as I reduced that, it helped quite a bit. And to be candid with you, by doing that, it also worked on my neck. I found that if I use a higher CBD ratio for my herniated disc in my neck, it actually reduces the inflammation that's out there. So I'm more of a, Well, I say a 4 to 1 person, I use 4 CBD to 1 THC. That's what I found to be very effective. Although if I do have a lot of pain, I'll go to a 1 to 1, and I might go to a 2 to 1 or a 3 to 1 CBD, depending on the pain level that's out there and what's out there. I found that vaping also helps quite a bit to be able to control the pain. But that's a very, very good comment. Jerry has a comment. Does mixing a sativa with certain indicas cancel the benefits? Actually, not at all. In fact, if you've probably heard of something called a hybrid is a mixture of both sativas and indicas. Each one has its own particular cannabinoid. It has its particular, how should I say, healing properties. More importantly, it's not really a matter of the sativa and the indica. It's more of a matter of what's the terpenes that are in those sativas and indicas that really be able to help you. So the answer is no, that won't cancel the benefits. In fact, if anything, it'll help the benefits of it. But what you really might want to take a look at is the terpene profiles that's really out there. That's it. Larry has a good question. It says, what if you have a heart condition? That is an excellent question. Now, notice, and I showed earlier, that cannabis is distributed through your bloodstream. So you've got to be very, very careful about, especially with heart conditions, you got to be very, very careful. There are many patients I have that actually work and have heart conditions that do take cannabis and helps them with their situation. However, if you're on blood thinners, if you're on heart medications, my suggestion is have your doctor work with your cannabis doctor to come up with the right formulas for you. What you're typically going to do is use a little bit less of the pharma medicine to complement what you're doing with your cannabis products, and it'll work very, very effectively. But again, if you're on, because what it's doing is it is helping your blood system. It does thin your blood system a little bit. You don't want to over thin your blood system, is what I'm trying to point out. So I think you need, again, talk to your doctor. You can use it, but there's not a formula for it. I suggest talking to your medical marijuana doctor as well as your medical doctor. Question: your medical doctor is absolutely against cannabis, and he's not going to entertain it, and he says, go away. My answer is find a new doctor, because you got a guy that's coming from the dark ages. To be blunt, a lot of doctors today are really getting into the benefits. I'm doing a lecture on October 29th on to doctors in Tampa, and the subject is what doctors should know. And the reason is because doctors really want to know. There's a lot of doctors that are trying to come out with this. So what I'm trying to point out is find yourself a doctor that at least will work with your medical marijuana doctor that's there. Again, you're trying to make sure you're not thinning your blood too much, and that's what we're really trying to accomplish. I hope that answers that question. Nick, thank you for the great comment about awesome presentation. For those of us that worked hard to put it together, both our commentators and myself, we appreciate that. Thank you. There. So we've talked a little bit about dosing, and we're going to talk a little bit about microdosing in a minute. But before we do that, we talked about, can MÜV really help you? And so let's talk a little about MÜV. You know, you have world best of products, world class. You know, Michelle, what I love about your company is your founder came from the pharma industry and really understood the therapeutic benefits of cannabis, because I think his daughter used cannabis, right?
I believe so, yes. So I've been in the industry for about 5 years, and MÜV definitely has been always on the radar for what I would like to consider the top companies right now in Florida, just because they do have that variety of medication. They do have a variety of different routes to use. You're just not going into a dispensary to purchase one thing. You're able to leave there, with some topicals and drops and capsules and the inhalers, the patches. It's a variety of products that we are allowed to make and create for these patients that are great. And we actually have the encapsulation patent on it, so it goes a little bit more beyond, what we're creating. Here
you go. Yeah,
so
and
that's the encapsulation. Yeah.
And what I think it did was his background caused him to really pay a lot of attention to quality and to testing. And I think that's what separates MÜV from a lot of other dispensaries, is the quality and the testing of the products that are out there. And you were one of the first dispensaries to come up with transdermal products and patent them both here and in Europe.
Yep, exactly. And they're great. I recommend these. I talk about these capsules, the patches, and the creams all day, just because they work so well. And as a patient myself, it works for me. Those patches are great, and the Evolve gel's phenomenal.
Sure. Now you take a look at routes of administration, there's sublingual drops. We talked about those. We talked about inhalation, capsules. These are the products that match up to the different routes of administration. Here's the famous patch that's here. And I love your patches. I think MÜV does a couple of things that is unique to the industry. Number one is you have your transdermal patch, which I just love because it lasts 72 hours. And here's the inhaler that we talked about earlier. It's there. I think you're the only ones in the industry with those two products.
We do.
That are out there. And
there's another patch out there, but they're not, I don't think it's a waterproof patch either.
And they typically last only about 8 hours, by the way.
Yeah.
Yeah, you hear a lot of patches that are there. So yeah, I think you clearly set yourself apart by that. And these are some of the tinctures that you're seeing over here. That you were talking about your Rso tinctures and that type of thing. I think when you have to be careful because some of the tinctures, if it's not a tincture oil, can be very, very thick. They're almost tar based. So really, I prefer the tincture oils as opposed to the actual harder versions, but it depends on what you really like.
Yep, I agree.
And then you have a very effective gel called Evolve, which actually works very well. That I found is very effective when you're traveling. That are here.
The Evolve gel's great.
Yeah, and I want to spend a moment on vapes because vapes got a bad name about a year and a half ago by basically some bad actors coming into unregulated markets with no testing, and it killed some people. And there's been action taken here in Florida. Products you buy from a medical cannabis dispensary that's licensed by the state, the products are tested 3 times, twice internally and 1 outside. And I always want to make sure everybody understands that vapes are very, very effective. In fact, I recommend vapes for a number of different situations. They're fast acting. There's a number of different ways that you can use it. Over here, there's flower cups, there's there's dart pens, there's vape, but in each and every case, they're tested and they're safe. Is that safe to say, Michelle?
Exactly. And I always tell patients, don't be scared to ask for these lab reports. As a patient in Florida, you're allowed to. We're allowed to have, you're allowed to ask for these. We have to have these at the dispensary, and it's always good to just know what you're getting from. Everything in Florida has to be grown here in Florida. So you're getting something that's been grown within a few hours of you. We're not shipping anything or anything like that.
Sure.
But I always suggest patients to ask for those COAs just so they can see and read what, we're actually putting in them, what they tested for, what they didn't test for and whatnot.
Sure, it's there. Now, you're located in a lot of different locations. I know I put 60 in here, but I think you have 61, is that correct?
61, yeah, exactly. And we should be opening up some more by the end of the year.
I love it. As I work with y'all, it seems like every time we do a webinar, there's a number, I always get this number wrong. But what I'm trying to point out is there are a lot of the dispensaries that are close to you. And I think from when Ian hit, you still opened up a lot of them. They're opening and operating today, correct?
Exactly. Some of them, we do have 1 or 2 that aren't doing that great. They did get a little impacted more than the other ones. Those are closed for now, but we do have Panama City open. We're going to be opening up also down here soon in South Florida. But all our West Coast stores are usually, all of those are open. The times might be a little bit different, but most of the stores in the West Coast are open.
Yeah, I know you've done a great job of trying to basically open up a lot of these stores because there's a lot of people that are just candidly, they're stressed. That's why I put it.
Yeah, exactly. And a lot of these stores also do delivery, and if they can't get out there, we will deliver.
Sure. Now, one of the other things that's nice is they can call you, they can email you, or they can actually do live chat. And I love your live chat option because a lot of times people will need some consultation, whether you've been in cannabis for a long time or you're just getting new to it. Call MÜV, book a half-hour consultation. You can do it on the phone. You don't have. You can do it in the dispensary itself, or you can do it on the phone. You will learn so much about what's good for you, what works. It helps you individualize the product for you to help you quite a bit.
Yep, exactly. You could always call any questions, anything. Is if you leave the dispensary and you have all these questions that you weren't able to ask the bud tender, you could always call that phone number. There's always someone to help and answer all those questions for everyone.
Sure. Now, here's the one-on-one consultations. Here's the links that you can go to find them. I cannot stress more the consultation and the live chats that will help with people. If you have questions about what products, what to use, what's the names, there you go. Okay, I don't want to leave people hanging after this. So let's get back into talking about dosing. We talked about microdosing. Microdosing is very, very interesting, where you basically, this is what your transdermal patch is doing. It's putting a little bit of cannabis into your body constantly throughout the day. It's very much, again, like I mentioned, like athletes or physical trainers that tell you we want to eat 4, 5, 6 times a day rather than 2 or 3 big meals. That's basically what microdosing is all about. And it's really, really effective. You'll hear that term, and I can't stress more that if you really want to get the most out of cannabis, take a look at microdosing. Break it down into smaller doses and using it during the day. And that's what makes the patch so effective. Now, higher doses. We talked earlier about I take a lot more THC and it doesn't work. These are just some studies that were done. We had some opioid patients that had actually tried cannabis, and what they found is that they tried opioids for cancer. It was not necessarily working that well. What they found out is that when they combined THC and CBD together, they saw significant improvements in pain. That's what's really, really interesting, is where you actually tried it in certain situations and got it out there. What's interesting is the group that they actually tried that had high THC, in other words, used THC, got no better effects than the placebo. And that's what I find very interesting. So that CBD and THC, that ratios really are effective for a number of conditions. This has to do with pain, but whether it has to do with gastrointestinal problems, has to do with anxiety, stress, really mixing CBD and THC together is really effective. Now, this is a very busy slide. I don't want to spend a lot of time on it. All I want to do is show you that when somebody asked earlier that she found out that she used more THC and it caused the other side, what CBD THC can do is it can degrade the actual receptors themselves, and that's what they're showing you in these pictures. By blasting it with THC, it's actually taking down the efficacy, excuse me, of the receptors themselves. Here's another study that was done out there with 177 patients using an oral spray, and again, they were using a 1-to-1 spray, and it showed you how effective it's really used by using a combination rather than just one particular type of product itself. It's over here. They found that the CBD plus THC was far superior in reducing pain than just THC by itself. So the studies are there. So let's wrap this up. What are my options? What are my options that I have? By the way, before I jump into that, Colleen asked a really good question, and that is, what is the name of the tincture or edible that is 20-to-1? I think that's your RSO. Is that correct?
It is the RSO, and it's an ACDC. It's called ACDC.
Right. So I hope that helps. Okay, but really, if you're looking at a product that is going to have some THC in it, you really got to get a Florida medical marijuana license, and I recommend MMTC of Florida to get your license. Why is that? Well, because they not only have 25 clinics here in Florida, they're fairly well distributed, but more importantly, they have a dosing program that when you go there, they'll actually help you get your dosing correct. They actually have a dosing center, and they'll be able to help you with that. They're the only doctors in Florida that will help you with your dosing. And again, dosing is absolutely critical to getting the maximum benefit out of cannabis. And I recommend MÜV. And the reason I recommend MÜV, not just because you sponsored this webinar, but I recommend MÜV because I think being able to mix your own products, being able to use the THC and the CBD, put that together, really makes it cost effectively, and control-wise, it helps you be able to get the dosing that you're really, really looking for. I'm a huge fan of that. If you're looking at a hemp-based product, that people say, well, gee, I don't know, I don't want to get my card. What do I get a hemp-based product? We put together a online site called My Botanical Wellness. We sell hemp-based products. What makes this different from all the other hemp-based products out there? Because we had doctors and pharmacists vet the products to make sure that they were, in fact, quality products. What's in the bottle and on the label match. And that's not always something that's out there. And also, we have all the COAs are available for all the products that are out there, the certificate of analysis. And last thing I'll point out is most physicians recommend using a full spectrum product when you're going through the dosing process, having it available to you so that if you start getting those negative side effects, you can take an equal amount of this full spectrum product. It'll bring you right back to where you were fairly effectively, usually within 20 minutes that it's out there. Right? Go to the next one. So timing wise, what's interesting, what's interesting is from a timing standpoint, this is my regime that I take right here. People ask me, what do we do on a daily basis? Here's the trouble is here. When I wake up in the morning, I hit it with a vape pen. I then come over here and I then have a tincture oil. And then as an alternative, I have an oil that I actually made myself. I actually have taken flour, put it into a magic butter machine at 160 degrees and made a tincture oil that does not have CBD and THC in it. It just basically helps you quite a bit. And so there's alternatives that are there. Usually in the afternoon, because again, as you take a look at the effective ranges over here, I've got to do something. So again, I have my vape pen, but I go usually in the middle of the day. I'm very heavy on the 1-to-1 ratios. And these are the terpenes that I'm looking for in the products at that particular time. And then in the evening over here, I have, again, a high THC vape pen if I need it. I have the 1-to-1s that are over here. And again, I have my tincture oil. And then usually at bedtime for sleeping, I'm a chocoholic. I grab a little bit of chocolate and I'm able to use that, be able to go forward. So this is basically my regime over here that I've experimented with. I recommend people take the table like this and be able to do something with it. If you go to the patent information brochure, which you're going to get a link to as a follow-up to this, look at page 17 and page 18, or go to marijuanaaware.com with the patient PAB. It'll actually give you a table that you can actually start filling this out, and you keep track of what works and what doesn't work, and be able to track that's out there. So, and then of course I mentioned the full spectrum, the hemp-based product, everything from gummies to topicals that are out there. Again, these are hemp-based products, and there are discounts that come along with this for first-time patients, MMTC patients, and if you watch this particular webinar, it's out there. So Michelle, how did we do in answering our questions?
I think we did great. I think we did great. You know, definitely patients are going to be leaving here with a lot more information, you know, and a lot more confidence to go in there and start shopping for different products.
Yeah, I mean, if you take a look at, you know, hopefully we answered a lot of the questions of why didn't it work? How do I feel? What if I smoke a joint? You know, a lot of those, the expense is one that people typically take a look at. All I'm saying is it's something that really helps be able to help people be able to go going forward. Now, Anthony, you were making a comment here that says only MMTC physicians working with patients on dosing. Actually, it's not just the doctors themselves. There are practitioners and medical cannabis practitioners like myself who work with MMTC to help be able to provide the information for patients when they're doing dosing. Doctors are good at knowing doctor stuff. Not all the doctors have studied cannabis to the level that I think they really should. That's because it's so new and there's so much information out there. And to be candid with you, it's coming so fast. More medical research has been done on medical cannabis in the last 18 months than in all the years prior to that. And it's really accelerating. So staying on top of it, it's really something that's there. MMTC does a good job of being able to provide the information to the doctors. More importantly, they have practitioners in a call center that are able to answer those questions. And that's what we're really trying to do, is really get the information out. And we're trying to do it in a way that makes it easy for people to be able to understand and be able to move forward. So hopefully we've answered a lot of questions that are out there. I'm going to shamelessly put in a plug for our upcoming webinars. If you have pain, you're an athlete, take a look at some of the upcoming webinars. You're worried about sleep, we have one on sleep. And I should also point out that if you go to our website, marijuanaaware.com, and you look at the follow-up tab, you'll be able to see the past webinars that we've done, both the videos and the presentations. So you can be able to look into areas like anxiety and stress. There's some questions on that. You'll be able to see our webinar on that, our slides, and what product we really recommend for that. So, Michelle, comments?
I think we're all good. I think we've said definitely everything, you know.
Yeah, I think we covered a lot of ground. I know that dosing is something it's not complicated, but it's something that takes patience and it takes time.
And it's a trial and error, and that's what patients, I feel like they don't want to hear, but unfortunately it is a trial and error, because it's not, you know, like a pill that you're going to take and it's going to help you, it's going to put you to sleep, you know. It's something that you need to get your body accustomed to. So definitely trial and error in a lot of patients, you know, but everyone will find their sweet spot eventually.
Yeah, I mean, I wish I'd have known about dosing when I was getting into drinking in college. You know, seriously, go low and go slow would have been a nice formula to follow. Same thing happens here. In other words, but you're in control. I think that's really the key. And this is something that your body, one thing, if you get nothing from this webinar, listen to your body. Your body will tell you what works and will tell you what doesn't work. Your body will tell you if it's being effective or it's not being effective. You can ask the doctors. The doctors aren't going to tell you what your body's doing. Your body will tell you what you're doing. And I found it's very comforting to know that I'm in control and I know what my body tells me. And I know if I go certain that get to that negative side, I have a product like CBD that can bring me back to where I'm at. I think it's there. So, Michelle, any closing comments?
I think we're all good. Like you said, I think everyone just needs to understand that they are the ones in control. They're the ones that are going to be the ones who actually know if the medicine is going to work for them. So it's all about being patient and dosing correctly.
Sure. Well, I want to thank everybody for joining us tonight. I know this is fairly long. It's something that you know, we've got an hour, almost an hour and 25 minutes, 26 minutes. Thank you very much for joining us. It's been very long, and I hope this has helped everyone that's out there. Keith, you had one question. This is, where do I find some suppositories?
So
do you carry those?
we used to, and there was another company that used to, but unfortunately we don't carry them anymore. I would suggest making your own. You could buy everything. You could get the distillate or the Rso. You could get the molds online, and then there's actual, if you reach me off this, I could definitely help you out with that. But we don't have them anymore. It's funny, when we have products, you know, the patients don't really look for them, but when we stop carrying them, all of them start looking for this product. But right now we don't have any, and no company right now in Florida does. But
yeah, I know that they changed some of the regulations on suppositories, and that's why a lot of the dispensaries had to go back and retool. Yourself and a couple other dispensaries had it. I don't know of a dispensary right now that carries this. I know
none
that
of them
companies did, but again, because of the regulations that they changed it, they're not out there. But I do want to point out there are practitioners, and there are ways of actually making suppositories that aren't really complicated. No. But it's something that unfortunately, because of state regulations that's gone on, reacting to state regulations, it's something that, which it's an open area right now. So I hope that answers your question. Anyway, I do want to thank everybody. Michelle, I want to thank you tonight. Great comments. Thank MÜV for sponsoring this. And also I want to thank everybody for showing up tonight. I know it's been a long webinar. If you have any questions at all, please send an email to event@marijuanaaware.com. We'd be more than happy to answer that. And we're here really to help. Before I sign off, I do want to thank our moderator, our commentators, Lee and Leah. They do a lot of the work in the background. I get all the credit, but they do all the work. So thank you very much for that. The person that actually caused this to happen, the person who made it all happen, Alyssa Katera, was the brainchild. This is her brainchild, and what we're doing is we're just continuing to do this. Her idea of being able to do these types of webinars. So anyway, I want to thank everybody for joining us. Please stay safe. And I hope everybody made it through Ian, and more importantly, months ahead, days ahead, anxiety, stress, pain. Cannabis can help. It really can. So we hope it's there. Michelle, thank you. Have a good night. Everybody have a good night. Have a good weekend. And I hope to see you next week for pain management.
Yeah, thank you so much.
Thank you very much.